An hour's drive from Zimbabwe's capital Harare lies the rural town of Chipariwe. Here, most people are subsistence farming. And not long ago, women couldn't afford healthcare for their children or give birth at a hospital.
I'm Tekla. Ndakanga ndisina mari yekunyoresa. Ndakanga ndisina zvekare zvakakwana zvekuti zvaidiwa pachipatara kuti mwana agogona kupfeka nezvimwe zvekushandisa zvakakonzeresa kuti ndingoti arige ndingosunungukira pamba. Zvinhu zvinenge zvakangooma because munhu unongofanira kusunungukira pachipatara. Asi nekuda kwema-difficulties iwayo zvaikonzeresa kuti tisunungukire kudzimba. Pandakanga ndisina ndakanzwa kurwadziwa because ndaitoziva kuti ndaifanira kusunungukira pachipatara. Munhu wese akanga arwadziwa nemimba anofanira kuenda kuchipatara, but nekuda kwokuti unenge usina zvinorwadza kuti munhu ungonzi wasunungukira mumba.
When Tekla's second child was born this year, circumstances had changed.
Here is an RBF baby. I delivered here on 29 February. It was a breech birth. I stayed at Marondera for 8 days, but I didn't pay anything.
RBF is results-based financing, a program in Zimbabwe that provides funding to hospitals and health centers for healthcare services for women and children under 5. Grants are awarded based on achievements in both quality and quantity of services delivered. Payment is made only when results have been independently verified. The program ignites passion and gratitude among rural residents across Zimbabwe.
Chirongwa che-RBF chiri kutibatsirawo pano pachipatara pedu cheSomerset.
Peace of mind will be with you. I want to thank this program very well.
The program is part of Zimbabwe's effort to reduce maternal and infant mortality, which remained high in the aftermath of the country's economic collapse.
The state of maternal and child health in Zimbabwe is in a rather difficult situation currently. We do have quite a high rate of maternal mortality.
During the crisis, limited funds for health facilities resulted in a number of informal user fees and onerous requirements.
Zvinhu zvemwana zvokupfeka one, mapads, macandles.
RBF removed those fees and requirements for routine care, including deliveries for pregnant women. RBF covers births with complications like Gohoris.
Ndasingafungi futi kuti kune mari saka ndaingoda upenyu hwemwana because ndaiziva kuti kumari kune vari kundibatsira, so hazvina kunyanya kundirwadza.
The government of Zimbabwe, working with the World Bank and Dutch agency Cordaid, has expanded the program to 18 of the country's 62 districts, reaching nearly 3.5 million people. RBF in Zimbabwe is funded by a $15 million grant from the World Bank's multi-donor Health Results Innovation Trust Fund at the request of the Zimbabwean government.
The main difference with RBF is that rural health centers get to have a say in how they manage their finances. In the case of RBF, the money is deposited directly into the temporary deposit accounts of the health centers. So they actually make decisions on how they are going to use their funds.
For doctors, nurses and community health center committees, RBF means greater opportunity for local level planning.
Whenever we want to do our plan, we sit down with the sister in charge, the health center committee. We identify with our indicators what we want to do at the clinic.
Many have used the new funding to renovate buildings and improve nurses' working conditions, improving their motivation to deliver better care.
Because some of the nurses where they are staying, there was no electricity, but when we started the RBF programs, electricity was installed, and some of them, they now have the generators, some of them have got the solar panels. They are now using the solar panels, as well as they are getting the water system, which was not in place. Some of them have dug deep wells, so they now have water, they now have electricity, so they are now motivated.
Under RBF, more patients and better care means more revenue for the clinics, so nurses and health workers have quickly developed a streamlined approach to patient care.
The clinics, when they book a mother, they give health education that this mother is supposed to have at least 4 to attend at least 4 ANC visits before delivery. They'll give her all the tests she's supposed to do. You are given tetanus, you are screened for tetanus immunization status. Then when this mother is booked and she has attended the ANC visits, she will deliver at the clinic. They'll also encourage her to deliver at the clinic. After delivery, they'll go through with her. They'll give the immunization to the baby.
That has led to more care and better care in a short period of time. The 2 pilot districts saw the number of prenatal visits and hospital deliveries skyrocket.
And then when RBF came, it started to increase here.
Even the 16 districts that adopted RBF just this year have seen an average increase of 6% in institutional deliveries to almost 2,500.
Every other indicator has just improved, and we have set ourselves targets and we're able to reach them and sometimes surpass them. The secret to our success is unity and dedication.
The community health center committees are a secret weapon.
They also wanted to send a message to the community so that they know they can access maternity services for free. So we used some of the money to do what we call social marketing. So we used some of our committee members, these influential leaders here. They went into their respective communities and started to talk about the services they can get for free due to the RBF. We had to do the social marketing and make sure that every mother in the community has the message. They are coming, and we haven't registered any maternal death since we started.
That means better lives for women and children.
Tinongotendawo program iyoyi nekubatsira kwavari kuita because zvakuraramisa vana vedu vakawanda, plus kana isusu vabereki vacho tabatsirikana zvakanyanya. Vamwe madzimai vari kusangana nedambudziko rekuti ukasunungukira kumba unogona kuburitsa ropa rakawanda munhu zvinokonzera kuti ugone kutofa usati wasvika kuchipatara. Saka madzimai akawanda takaadvaiswa kunzi kwanga wangoona zvinhu zvisina kumira zvakanaka wakurwadziwa uya kuclinic plus uya unyorese pachena. Saka zvabatsira upenyu hwemadzimai wakawanda tasurvive zvakanyanya. Saka tingoda kutenda program iyoyi kuti iri kutibatsira isusu vanhu vechidzimai. Vari kuwana zvakakwana vari kurapwa zvakakwana zvekuti vana vedu havasi kufa.
I'm very happy to see my people being helped by the RBF.
Kushona, we can say kurangarwa na Jesu zvaringana. We are very, very happy.